Hello friends, in the last video I discussed about vertebral column, vertebral notch, vertebral foramen and parts of vertebra. In this video I will discuss about cervical vertebra. Total number of cervical vertebra is 7, out of which 3 are atypical and 4 are typical vertebrae. C1, C2 and C7 is atypical and C3 to C6 is typical vertebra. So we all must be wondering what is atypical vertebra and what is typical vertebra. So first of all, let's understand what is the difference between these two vertebra. Typical vertebra. Typical vertebra consists of vertebral arch, body and several processes. You know there are several processes in the vertebra like transverse processes, spinous processes. In the last video I discussed about all the processes which are there in vertebra, so you can go and watch there. And the atypical vertebra which doesn't have similar characteristics to typical vertebra, like they don't have body, they don't have some arch, and some there is lack of some processes, means atypical vertebra, a structure of atypical vertebra is highly modified according to functions and position. So in this video we will discuss what first cervical vertebra. First cervical vertebra is called atlas. It is ring shaped and it has neither body nor spine. If you look at this image, it closely look like rings. It has neither body and nor spinous process. Cervical vertebra consists of two lateral mass and two arches. First, let's study about two arches of this cervical vertebra. Two arches are anterior arch and posterior arch. Anterior arch is short and posterior arch is long, and which forms 2/5 of the ring. I will show you where is anterior arch located and where is posterior arch located in this image. So look at this image. In this image, this part you see, like this part is anterior arch, and if you see posteriorly, this part you see like this, all is posterior arch. So what are the features of anterior arch? Anterior arch is marked by median anterior tubercle on its anterior aspect. If we look at the anterior arch, this is a tubercle on its anterior side. This is anterior side obviously, and this is posterior side. So on the anterior side of anterior arch there is a tubercle which is called anterior tubercle. If you look at the posterior aspect of the anterior arch, look here, this is the posterior aspect of the anterior arch, and this aspect consists of a facet which is called, this facet you see, which is called articular facet for the dens. Here I also wrote like articular facet for the dens on its posterior aspects. Next is posterior arch. Posterior arch posteriorly is posterior tubercle. If you look at the posterior side of the posterior arch, here this is posterior arch, and on the posterior side here is one tubercle. Look, this is called posterior tubercle. And another one important structure is also found on the superior surface of the atlas, that is paired group of vertebral artery on the superior surface. If you closely look at the superior, this is superior view. On the superior view, this part here is there is a groove which consists of vertebral artery. This is group for the vertebral artery. Don't we will discuss about vertebral artery in the circulation part, so just for now remember this. Next is lateral massage. As I told you, cervical vertebra, first cervical vertebra consists of two lateral masses and two arches. We already discussed, and the next we will discuss about lateral mass. Lateral mass is located at the point where anterior and posterior arch coalesce. So if you look at this image here, in this image I told you like this part is the, I take this part is the anterior arch, this part is the posterior arch, and the meeting point is this of anterior and posterior arch. This is the meeting point, and this part is called lateral mass, this part. So each lateral mass is so on the upper surface a facet that is called superior articular facet. If we look at the superior view of the first cervical vertebra here, this is superior view. Here you can see superior view. On the superior view, this facet, this is superior articular facets of the lateral mass. So there are some features of superior articular facets. Superior articular facet is elongated, curved, upward and medially directed. If you closely look at the superior articular facet, look, superior articular facet is on the upward, elongated, concave and medially directed. It is like little bit medially, not laterally. Here also it is medially. And one most important things about superior articular facet is superior articular facets articulates with the corresponding condyles to form atlanto-occipital joint. So if we discuss about atlanto-occipital joint, look, this is the condyle which is found on the occipital bone, which is occipital condyle, and this is the C1 vertebra, that is called atlas. On the superior surface of the atlas there is superior articular facet, and these two forms a joint, and that joint is called atlanto-occipital joint. If you closely look at the lower surface of the cervical vertebra, lower surface is marked by the inferior articular process. As the name suggests, inferior articular process which will be located on the inferior side, and this is the inferior view of the cervical vertebra, first cervical vertebra. In this image, look here, these two is the inferior articular surface, or you can say facets. So what are the key features of this inferior articular facets? Inferior articular facets is circular, it is more or less flat. What about the superior articular facet? That was elongated, but it is little bit circular and flat. Here if we see, it looks somewhat circular, and it is flat, not concave, which was in case of superior articular facets. Important features of this inferior articular facet is it forms atlantoaxial joint, uh, which articulates with the facets on the C2 vertebra to form atlanto-occipital joint. Next, we will study about the third, that is transverse processes, which is projected laterally and has a foramen called the transverse foramen. If you look at this image, this is the transfer. This part is the transverse process, and this has a foramen, which is transverse foramen. Also, this was inferior view. If you look at the superior view here, this is transverse process and has a foramen, that is transverse foramen. So that's it for this video. In the next video, I will discuss another vertebra, that is C2 axis. Thank you.